Hi everyone, it's Tammy Sharrow, and in this narrated PowerPoint, I'm going to be talking and introducing the research process. So this is Health 2250 and our week 2 content. So the learning objectives for this particular session is for the student to know that there is a research process and that this process is reflected in the headings of a journal article that you might read online, that you're able to list and describe the phases of the research process, that you're able to link the phases of the research process to the headings or sections of a research article, and you're able to articulate kind of the basic history and purposes of the research journal. So if you were to go online and Google the research process, you would probably find quite a number of different approaches. But I found this one and I really like it, and so I'm sharing it with you. It's from Thane in 2013 from a textbook called Reading, Understanding, and Applying Nursing Research. So Thane breaks the process down into 5 phases or 5 major steps, and you might see some research process models that have more steps or less steps, but basically they all contain the same thing. So the phase 1 is the selection and defining of the problem. So you're going to identify the problem that you want to be able to solve or explore. That problem may have come from a clinical problem, a clinical curiosity, a debate in clinical. So quite a variety of places that this problem can come from. So we identify the problem and the purpose statement. What is going to be the purpose of this research? What are we hoping to aim, or what's our major objective? And then the next step is often a review of related literature. So we want to, and I'm going to talk about this in a few slides, but this is a really, really critical step, and it gives the researcher a lot of information and really helps them formulate their study. If we're going to specifically look at something that involves variables such as an independent variable and dependent variable, we're looking at the relationship between those. We have to tease those out right from the beginning. And then from there, we would formulate our research question and hypotheses. Not every study states a hypothesis, but some do, and it's helpful because it's the researcher's best guess as to the outcome of the study. Then we move on to phase 2, and we decide what research design is going to be the most effective to answer our research question. And as we talked about last week, looking at both the quantitative and qualitative domain, it really is that research question that should dictate the design that you choose. It shouldn't be the other way around. So within this phase, we'll also identify a sample, the sample that we of the population we want to conduct our study in. We might look at the setting for that study. It might be in a lab. It could be, interviewing people in the community, etc. And then if we are going to be measuring anything, as in a quantitative study, we really have to define all our measurements exactly and really clearly lay out what it is we're measuring, how we're going to measure it, how we're going to describe it. I think last week when we looked at just the abstracts of the studies on kangaroo mother care, the quantitative study clearly laid out, who's going to have kangaroo mother care, how often are they going to have it, how long are they going to have it, how are we going to measure, oxygen saturation and respiratory rate in an infant, how will we measure maternal confidence and maternal stress, those types of things. Then we moved to phase 3, and this is where we collect our data. So depending on our paradigm, quant versus qual, data collection methods can look quite different. So this is often, can be a lengthy part of a research project, and it requires a lot of rigor and really systematic record keeping, those types of things. Then we move into phase 4, which is our data analysis phase. So now we're going to analyze the data and interpret the findings. So once again, in a quantitative study, we're crunching numbers, we're doing mathematical computations, we're looking for statistical significance, means, medians, or in qualitative research, we're poring over transcripts from interviews, looking for patterns or themes. Then we produce our results, and in phase 5, we're going to disseminate those findings. And this is a really, really important step, and now a step that is expected when you submit a research proposal to the Ethics Review Board. They expect you to lay out how you plan to disseminate your findings after your study is done. And then ultimately, we want to move those findings into practice and be able to, move it into evidence-based practice and apply it in our day-to-day client care. Okay, so sort of starting back at the beginning of the research process, how research began, phase 1. An old textbook we used to use was Bouma et al. And they talked about research starting with a question or a curiosity to settle an argument or a debate. What is more effective to solve a problem or a concern that has been identified, sometimes to improve efficiency of care, to reduce cost of care, to improve the patient experience. All those kinds of things can, stimulate a research question or a research project. And so the big step here in phase 1 is identifying the problem and the purpose. So we need to clearly identify the rationale for conducting this study. So why is it an important study to conduct? We don't do research just for the sake of doing research. We need to justify the need to investigate this particular problem. It may be that it's a common concern or common problem, or there hasn't been adequate research done on it in the past. And this is where the Lit Review becomes really handy, when we can see that there's really a dearth of research on this particular topic. So sometimes we are refining existing knowledge, or we may be studying something that really hasn't been studied at all before, so developing new knowledge. So in defining the topic, as I mentioned, a big part of this is the literature review. And so this is where the researchers do an extensive lit review. Typically, they'll look back over decades of research, specifically the last 10 years. And what the literature review helps the researcher do is it helps them identify and prepare good research questions. So they'll see what other people have studied, what their results were they able to answer their question, what were the limitations of their study that you could improve on. It helps you determine what is known and not known about this particular question. As I mentioned, it helps to identify strengths and weaknesses of previous studies. So, as I said, every research article has a limitation section, and you might find that they conducted this study, but they said it needs to be further studied with a larger, more diverse sample. So maybe that's something that you plan for your research project. So it does assist with research design issues. And it also allows your studied results to fit into other knowledge that already exists in the area. So thereby allows you to advance knowledge on a particular topic. So the research question flows from this problem statement and the purpose, and it typically is written in a question form. And it sounds like a really simple step, but it is often a very challenging step, and it could take weeks to months to develop a really, really, really solid research question. And the tricky part is asking a question that you can answer, right? So the greatest challenge to any thinker is stating the problem in a way that will allow a solution. And sometimes this is where the hypotheses or the researcher's best guess might be proposed. We're going to look at hypotheses, I think next week. And, some hypotheses are directional, some are non-directional, but it is the researcher's best guess. And so to focus and narrow the research problem, we have a research topic. We identify the problem surrounding that topic. We identify the purpose of our particular research project, and then we go on to develop the research question or hypotheses. What is the question that the researcher would like to answer? And this can be quite different in a qualitative versus a quantitative domain. So on the left side with the qualitative domain, sometimes you won't see a research question, but you'll see the article state the purpose of this research, the aim of this research, the objective of this research. And so I've listed 3 examples from actual studies. And the first one was a study on women who choose to quit smoking while pregnant but then resume it postpartum, and the impact of social networks on that. So it was stated the purpose was to understand what influences the resumption of smoking among women who quit smoking while they are pregnant, with a view or a focus on social networks. And that was a qualitative study interviewing these women. Another study was done with children who had chronic health conditions, and the purpose of that study was to describe the understandings of condition management from the perspective of school-age children with a variety of chronic health conditions. And then the final study was a qualitative study looking at the lived experience of young adults who had grown up in their childhood with ADHD, attention deficit hyperactivity disorder. And so the purpose of this study was to describe the lived experience of childhood ADHD in the context of home, school, and friendships. And they interviewed university, college students who were accessing accessibility and accommodations. That's how they got their sample. On the right-hand side, looking at quantitative questions, I used the example from the kangaroo mother care study that we looked at last week. So the question was, one of the questions, there was 3, what is the effect of kangaroo mother care on the physiologic functions of premature infants. So you can see with that question, we'd need to have some really, really clearly defined measurement strategies. And we'd really have to describe in detail that independent variable and then the dependent variable that we're measuring. Second question example is, what is the congruency between parents' actual and desired level of participation in their hospitalized child's care? So they had a pool of parents in 3 pediatric hospitals, I believe, and they wanted to know, were parents involved to their desired level of participation? And what they found is there was a statistical difference between what they wanted to be doing and what they were actually doing. And then the third example is, what is the effect of a psychoeducational program on quality of life of patients with congestive heart failure? So this is a really good example of the independent variable, the treatment. It's not a drug, but it's actually an educational program, and they want to find the effects of that. So congestive heart failure patients typically have poor quality of life. So does this program improve quality of life? And of course, we need a way to measure that too. So just some good examples of qualitative versus quantitative questions, purpose, aims, objectives. So the next phase, the phase 2, deciding on the research design. Obviously, if we look at the quantitative domain, we're looking at numbers, gathering data, mathematical computations. We're often looking to try and describe how much, how many, how often. We look at numbers, percentages, rates, statistical difference. If we're looking at a qualitative domain, we're probably focusing on a description or exploration of qualities of some type of experience or event. We focus on feelings, perspectives, the beliefs, values, impressions of those individuals, and typically end up coming up with some sort of themes or patterns that arise out of our data collection that can go on to give more clarity and describe what's really going on here, with a mother of a child with autism, a woman who is diagnosed with breast cancer, a man who is diagnosed with testicular cancer, an individual who has congestive heart failure and poor quality of life. Sometimes, though, however, we do combine the two paradigms and the two approaches, and I had talked a little bit about that last week. And so when we combine methods, we often call this triangulation, and we'll look at that a little bit further in the course. And you could see how if you're exploring one particular dimension and you're able to gather both quantitative and qualitative data around that, those two data pools might validate one another and actually give more emphasis or impact on the evidence that you actually find in your study. Sample and setting is a really critical piece. So who is the sample that we want to study? Obviously, we can't study the whole population. So what portion of that population will we sample? And how big of a sample do we need? So often in qualitative research, our samples are much smaller. If it's something that has never been studied before, a sample of 10, 12, 15 might be an ideal sample. Whereas in quantitative, we actually use a calculation to determine the size of sample we need to detect a difference in the impact of our independent variable or our treatment, whatever that treatment might be. And then we also need to consider what setting we will collect our data in. So very different for quant versus qual. Our data collection methods, once again, very different depending on our domain, but this is phase 3. This is where we gather our data. So on the left-hand side here, more qualitatively focused, we might be interviewing face-to-face. We might be doing focus groups with, 8 to 10 people. Sometimes we might do even telephone interviews, or Google Meet interviews or Zoom interviews, now collecting data virtually. On the right-hand side is a little bit more focused on quantitative data collection. A very, very simple style of quantitative research is market research, is survey research. But we might be collecting samples. We might be analyzing urine results, blood results, CAT scan results, MRI results, especially when we're looking at biophysiologic data collection. And then I just threw the little picture of the lady with the binoculars in because sometimes in both qual and quant, we might incorporate observation where the researcher or the research assistant sits off aside from the participants and observes them. So there was an interesting study done looking at the relationship between nurses and midwives in providing care and labor support for women. And they interviewed midwives and nurses and looked at how they worked together as a team, what tensions arose, etc. But they also sat back and observed them and took notes through their observations to gather data to help sort of answer their question. And then phase 4, the data analysis. This is where we, as I mentioned, whether it be quant or qual, quite different data analysis approaches, but we analyze our data and then we interpret our finding. So we've got the numbers now. How do we relate that data back to the research question? This is where we draw conclusions about were we able to answer our question. We assess here, any challenges we might have had in the research process, how would I describe that? Any barriers we ran into, things that could have impacted our study results, assessing limitations of the study, and then this is a really important part to make suggestions for implications for practice as well as for future research. And then this phase 5, the dissemination of your findings. So typically the most common strategies for disseminating scholarly research would be a publication in a scholarly peer-reviewed journal. It would be presenting your research at a conference or a workshop, either in the form of an oral presentation or a poster presentation. But often our research needs to be disseminated more broadly than that, and it needs to also go back to the participants. Usually the researcher should provide some sort of a summary to the participants. Sometimes our research has implications for the public, and we need to share it with those particular populations so they can be able to take action. So you think about it, just in the newspaper or the news, often research is disseminated that way and might spur people to take action. We find there's a link between obesity and breast cancer. and we share that in a way. So our how we disseminate our findings is really, really linked with who we're disseminating it to, and we're going to address this in one of our last classes. So I just made this little chart to kind of try and align the research process with journal headings that you're going to see in the research articles that we're going to explore and you're going to explore in other courses ongoing in your nursing education. And so the problem identification and purpose is usually addressed right at the beginning of the research article. Sometimes it's labeled introduction, background, it might be labeled lit review, and this is where they provide a nice summary on what's known to date on this particular topic, what is the scope of the problem, is there a dearth of research, and they build a case as to why this research is worthy. Next would be a description of the methods, and typically this may include the research questions and the hypotheses, and often in a research article this would be titled methods or design. The description of the sample, how big is the sample, how it was recruited. It may include setting, it may include a bit of description of the sample, and so the article might have a heading called sampling or sample, but sometimes that can be just embedded in the methods and design, so you might have to go hunting for that a little bit. And that's where I find when I always recommend to students, when you're just beginning to read research and learn about research, actually printing off an article and marking it up can be really effective, because the sample might not have a heading sample and you might have to go searching for it. We haven't talked about ethics yet. That's going to be our next narrative PowerPoint, but ethics is always addressed in a journal publication, and before you even can venture down the path of your research project, you need to get ethical approval. And the ethics, if there was a significant aspect of ethics in this particular research project, it might have a separate heading, but once again, it might be just in a paragraph embedded under methods and design. Then we look at our data collection. So that typically would have a title, data collection. It might even talk about instrumentation if it's quantitative and they're using particular instruments to gather their data. So they'll look at, or if it's a qualitative study, they'll describe how they went about collecting their data. Data analysis, this is where we do either thematic analysis or content analysis, as we would with qual research, or statistical or descriptive statistics if we're looking at quant, and typically that will have a data analysis heading. And then there's results, so you might see it labeled as results or findings, and in quantitative research specifically, there's often tables or charts or graphs. And so when you're looking at those, you really want to, as we move on to appraising research, you really want those charts or tables or graphs to be understandable, to be linked with the findings, and to provide more clarity for you about the findings and results. And then lastly, dissemination. This is usually not addressed in a research article. It is addressed in the ethics proposal, and if you're getting funding for your research, your funding body definitely is going to want to know how you go about your plan for going about disseminating your research. And so sometimes in the discussion section, there'll be a discussion of how the findings fit into what is already known about the topic. So they'll compare and contrast their findings with what was already known, how it fits in. Sometimes there'll be actually some journals will ask for, what this study adds, and you'll have to create a little chart with 3 to 5 things that this study adds to what's already known or the knowledge already about this topic. And the discussion addresses, as I mentioned previously, limitations, implications for practice and future research. And then lastly, the conclusion is usually a brief summary, and sometimes this is where they'll include information about conflict of interest that could impact bias or funding. Thank you for listening.